What's up, everyone, and thank you so much for tuning in to yet another episode of Lattes with Lindsay. I'm so excited about my next guest. Her name is Mary. She's an osteopathic manual practitioner, and she's really going to get into what the actual profession is all about and, how it can benefit athletics as well as the general public. So, Mary, how are you doing?
Good. How are you?
Good. Trying to deal with this COVID-19, but getting through it. So,
We're all in the same boat on that one.
yeah. So why don't you tell us a little bit about yourself and some of the certifications that you have and, how you got involved in this profession?
Okay, so I'm going to start by saying I'm not quite an osteopathic manual practitioner yet. I finished all my coursework at the Canadian College of Osteopathy, and I'm just in the process of finishing my thesis now to get that final designation, which I should have in November, which is very exciting. But outside of that, I did my degree in kinesiology at Dalhousie University a long time ago. And then I have since gone on to become a certified athletic therapist, registered massage therapist, and am now working towards getting my osteopathic manual practitioner designation. And I think with anything, you kind of look back at the way you look back on things to see how you kind of got there. Each kind of designation I fell into as another progression or another step in understanding how to work with the body. And I did my degree in athletic therapy at Sheridan College. Which is the founding program for athletic therapy in Canada. And we were taught by a lot of osteopathic manual practitioners through that program. They helped build the program. And so they left you with a lot of questions and a lot of, I need to know more. And so I always knew I was going to go down that path once I was finished with my athletic therapy degree. And so I took 2 years off after that, and then dove into my 5-year program. Yeah.
Oh, that's amazing. And that's great because, like, clearly, as you can tell, guys, she's been working her butt off with education, which is the most important part. So that's extremely special. So that's great. And what is like one fun fact that people will try and remember about you after this podcast?
I always find that question hard. Like, what's one fun fact about you? I work with a lot of different athletes in different sports, but none of them are sports that I grew up playing. So I work predominantly with hockey, basketball, and lacrosse players, and played none of those sports growing up. I played soccer, and I was a competitive rower. So I was very accident prone and spent a lot of time in the rehab clinic. So I feel like I have that perspective. I just always think it's funny that I work with a lot of different sports that I didn't actually grow up playing myself.
Yeah. You know what? Sometimes that happens though, because I mean, you kind of build this like curiosity around it almost like, okay, well, I didn't really get to experience it. So what can I do to kind of build that knowledge with those sports? So that's really, I mean, that is a really cool fun fact. I like that. And with all those like certifications that you have, what is there one that has always been something you're most proud of, or like one of your biggest achievements with that career at all? Like,
I love being an athletic therapist, first and foremost, and I am extremely excited to be finishing my osteopathic degree and getting that under my belt, because it was, just a life-changing experience in the way that you work with other humans, and that's amazing. But I loved the foundation that I got from my schooling in AT, and the doors that it opened for me to be able to work with the people that I do, and not just the athletes that I work with, but definitely the people that I get to work with in the profession, because I have had the amazing opportunity to work with some epic people within our profession, and I wouldn't be able to do that if I didn't have athletic therapy behind me. And so I like layering in everything else. It makes me a stronger practitioner overall, but that athletic therapy degree really kind of is something I'm super proud and happy to be and always will be. for sure.
Yes, it is something that I definitely regret not doing. I wish I, finished my massage and went right into AT, because there are so many perks to it. And, not only working with athletes, you also work with the general public, which is so nice. You get a little bit of everything. So why don't you tell us about your profession, of what you're going to soon be, and, what does it really entail in regards to the actual treatments and how long they are and all that stuff?
So osteopathy is really the study of the human body as a whole and how everything is interconnected. And it looks at not just your musculoskeletal system, but it brings in the viscera, the organs, the cranium, the brain. It brings in, for some people, you can really get into working with like the spirit of a person, and really helping to balance all of those things, because we are mind, body, and spirit. And so I love that it pulls all of my mechanical knowledge in, and just gives you some things to kind of think about when you're looking at a body, which is really cool because of all the fascial connections. So the one thing I always say to people who have experienced osteo or have worked with an osteopathic manual practitioner in the past is they kind of look at it like it's voodoo, it's magic. And it's like a running joke, right? Like, you are coming in to see me for your shoulder, but I might go down and work on something in your hip, or where your hands on your feet, and everybody's just like, what are you doing? And really, you're just looking at it really just comes down to a solid base of anatomy and physiology and how everything is connected fascially, and if something isn't moving properly, then it's our job to kind of remove that restriction so that it can move better, and then it will help with. So really, it's looking at, okay, your pain is in your shoulder, but why is it there? Can it be because of the lung? Can it be because of the thoracic spine? Can it be coming from the hip and the way that those mechanics are working all the way through the body? And so that's really how it works. And it really ties in and pulls in that whole, the body has an innate ability to heal itself. And our job is just to help it be able to express that. And so there's a lot of freedom in the way that you approach something when you're looking at a body that way. And when you bring in that much knowledge around anatomy. So that's why I kind of love it.
Yeah, and that's the biggest thing, is that I find, like, when you have someone come into your clinic, or an athlete, they say, oh, I have pain in my neck from whatever it is, but it's, little do they know, there's so many things that attach to that and connect to that you almost have to do a full body scan and see, okay, well, maybe it's pulling from the opposite side or whatever it is. So, I think the best part about having so many, professions together is that you can kind of mold all of your experience and apply and educate that person that, it may be your neck, but it also could be from, your shoulder, or, something to do with your chest expansion, something like that, right? So I think it's so important for that also to be a huge thing for people to know, is education. So absolutely.
Yeah. You're working with somebody who has chronic pain or chronic conditions. Our body has compensatory patterns, and it compensates when something isn't working or moving as well as it should. And oftentimes our pain, unless it's something traumatic that has happened to the body, oftentimes it's a result of. And the one thing that I always get is, when I do a health history, I want to know everything. I'm looking at things that happened when I was a kid. I don't want to know what happened last week. I want to know all of it. I want to know, just how the body's going to react to anything, medication you're taking, supplements you're taking. It's not my job to know about those or to guide you in those. That's, you have doctors and naturopaths and everything for that. But it is my understanding to say, like, okay, well, that's going to maybe tax something in the liver and the kidneys, and create some fascial compensation patterns. They're just kind of systems, and understanding how they all work together to be able to kind of help settle things down a bit for what you're doing. So you want to really pull and get a good thorough history from somebody. Otherwise, you're just chasing pain, and that never gets anybody better. I think as practitioners, we all know that, or we should, that chasing pain and trying to help somebody with one particular area never results in making either of you happy. So you want to get to the root cause, and I find osteo was really good at helping me figure out what those root causes were. Yeah,
absolutely. And I think the health history is the most important part of an assessment. And I think some people get like nervous telling you things, or like, you know, I've had so many different occasions where, you know, I received their health history and I'm like, okay, like, so you don't have any of these? Oh, well, I mean, I did like a year ago, or, well, it was like 10 years ago, so it doesn't even matter. And it's like, no, people, like, it is crucial to know your whole health history, because if you didn't take care of it 10 years ago, then, you know, you have to think about how much your body has compensated in that time, and all the fascial planes that have adjusted and everything like that. So I 100% agree with you. It's definitely something that I think a lot of people don't realize the importance of it. And that's why we have to do an assessment so many times. So yeah, I agree.
And if there's like new grads or students that are there and they're unsure, because I find a lot of the times I work with a lot of different students and interns, and so you get taught to ask these questions, but you might not understand why you're asking the questions. So make sure you understand why you're asking the question. You don't want to get in a situation where when a client asks you why and you don't know just because they told me to. So understand why you're asking those questions, and you're usually asking them to do with the body system or, you know, injury history, but understand it. And if you don't, go pick up a book and figure it out, or ask somebody who does ask those questions. Like, there's no problem asking a question or saying you don't know something. So really, for like new grads and new practitioners, don't just ask a question to check it off the list. Know why, because that could be the answer to what their complaint is. Whatever their complaint is could be inside that question that you don't know why you're asking. So make sure that you understand that, and understand follow-up questions that should go along with it.
Yeah, exactly. Like, prepare for anything. And I think that's the thing that school prepares you a lot for, but then also like your hands-on experience really does give you that kind of push that says, okay, like, if they answer this way, I know it's coming with the next assessment or whatever it is. So yeah, absolutely. So how do you, like, as a practitioner, how do you know how long a treatment's supposed to be for someone? Or is there like a specific time, like massage, for example, where it's like a half an hour, 45 minutes, or an hour? Like, do you have a time frame, or is it just kind of like, who knows?
I always feel problem with the structure of a typical massage therapy session. And I think what's really cool about massage therapy is that there's so many different avenues a practitioner can go down, because our scope of practice is huge. And so you can go from coming in and getting effleurage and you know, your regular techniques done, or you can come in and get craniosacral done. And so they're going to look completely different, or myofascial, like all of that stuff is, and you and I have had that conversation before, like they're just such a broad range of treating people. The way I treat somebody is not the way that you treat somebody. So it's, but both of them are in our scope of practice. They're just added tools, right? And so I think the way I structure treatment, and the way if you're going to go see somebody for an osteopathy treatment, they will typically run between 45 minutes to an hour. And I mean, practitioners who are super great at what they do might stick to a 45-minute run because they know what they're looking for and they are going after their stuff. And for me, it's an hour. I don't know that I ever really see anybody on a half an hour basis, unless it's something that I just need to check in, and usually that's like an athlete that I see constantly and they just need something to kind of get them going for whatever practice we have coming up. But if you're coming in to see me, then it's going to be for an hour session, so I can get through history, what's changed, what's made you feel the same maybe. And I find too, with the way that we treat you can clear something up, but you might uncover something. So it's like peeling back those layers of an onion. And so they're starting to feel better, but you know what? Something is popping up over here and it leads you back down. Like it's kind of like following the path, right? And so I think for me, I feel most comfortable right now at treating on an hour session.
Yeah, which is
per
perfect. Yeah, absolutely. Because I think, especially like on their first time, it has to be at least an hour because, you are going to find things. And there are so many times where, you get into a situation where after the treatment, they're like, yeah, my shoulder feels good, but now my neck hurts. And it's like, oh, geez, it's like, you really
And that's
start to, take it
no matter
apart.
what your profession is, it's going to completely be a thing that happens across the board. I think the other aspect is if you're going to go see somebody, like if you go to the school, because I know our college has a student clinic, those sessions are an hour and a half, but it's because you're being taught or you're being treated by students, so it gives them time to make sure that they've gone through everything and they can review it with their prof and have things signed off on. But it's exhausting as a practitioner to do longer than that. So I'm happy like typically with an hour. There's very few occasions where I'm like, man, I could have just saw you for 30 minutes and you would have been fine.
Yeah. Yep. I know those ones. I feel those ones. So something that I typically get asked is, if it's covered by insurance companies. So I know that there's so many things that are changing, even with athletic therapy and stuff like that. But how are you going to cope in the future with insurance companies and coverage and all that kind of stuff?
So this is a key one, and I've talked to a couple of people because I knew how I wanted to answer this one. So yes, osteopathy is covered by a large majority of insurance companies. Again, with anything, you want your patient or clients to look at their own plan so they know what they've got. But the big thing with is that unlike massage, it's unregulated, and that comes with its own issues. And so there are really, to my knowledge, there's really 3 major schools that you go to and it'll be covered. So the one thing that is kind of cool for us is that the insurance companies have kind of started to regulate who an osteopathic manual practitioner is. So if you are going to go see somebody for an osteopathic treatment, you want to look at where they've gone to school. And if it isn't from the Canadian Academy of Osteopathy, which is in Hamilton, or the Canadian College of Osteopathy in Toronto, and there's another one and I can never remember the name of it. It's also in Toronto. It's new. Then I would maybe start asking some questions about what their background is, because we have a lot of places that teach osteopathy online. And osteopathy is manual therapy, and to learn how to palpate is a completely different skill when you're working as an osteo. And so I raise a lot of red flags on that right there. And so they have as well. So the surprise can come if you are going to see somebody and you haven't done your homework on where they've gone to school. And then in that process, they might come back and say no, because there have been a bunch of schools that they won't cover. And in that, the 2 associations that you typically join in Ontario for, and even outside actually, are the OAO and the OOA, for the associations for osteopathic manual practitioners to join once they've finished their schooling. And those 2 are the ones that are covered by insurance companies. So just kind of throwing that out there, just make sure, as with anybody, make sure you're doing your homework on who you're going to see.
Absolutely. And I think that's the most important thing. And that's why, like, I always love to know the answer to that question, because sometimes I don't know, like, I have no idea, like, and every insurance company is different, obviously. So, some will only cover like 5%, some cover like 100%. So it's always a good
question. And
I'm
like the last person to ask, because I tell my patients, like, I don't know what your insurance plan is, because everybody's insurance plan is different. So even as an athletic therapist, we have such a small amount of coverage that if you're coming to see me for athletic therapy, then just make sure that it's covered.
Yeah.
If you want to go that route. And only you're going to know that. So you have to call and ask your insurance company if that's something that was picked because your employer does it, blah, 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 blah. So you want to make sure that you know what you're covered for when you're coming to see any kind of practitioner.
Yeah, which is so key. Like I cannot stress it enough to anyone who is listening who wants to, get more therapy and all that kind of stuff that doesn't know, like definitely just call your insurance company, just, figure out what your coverage is and stuff like that. So that's so awesome. So, with all your professions, where are you working, these days? Like, where are you currently working, and what area are you looking to maybe build into?
So I own my own practice in Orangeville, Ontario, called Fortitude Therapy and Wellness. It's a home-based practice that I have. At some point, I'll grow into something bigger, but this is where we're at, and I absolutely love it. And I also work in Toronto with a strength and conditioning coach named Matt Nickel. And I work with his strength and conditioning coaches and athletes, and he's a huge mentor of mine and has helped guide me to where I'm at right now. So I love being able to work with that team and as a part of that team because it's outstanding. And so I'm down there as well. So you can find me in either of those places. And then I'm also the lead IST, which is, if anybody doesn't know what IST means, it's the integrated support team for the next gen or next generation athletes at Canada Basketball on the men's side, as well as the lead athletic therapist for the cadet men's national team. And I am the head therapist for the Orangeville Junior A Northman Lacrosse Club as well. So I work with a lot of lacrosse, basketball, and hockey players, and all of the other players and athletes that come in as well. But yeah, that's where I'm at. So I have my toes in a whole bunch of different little buckets.
Well, damn. Yeah, she's that person, guys. She is amazing. That is something that I truly admire about you, because you can be in 1,000 places at once. And, she's not in Canada, she's traveling the world. So it's amazing just to, follow her amazing story. So with that, even, out of all of those places that I've had even, one of the privileges to work at with you, what is one success story that you have of an athlete that you can think of that, really made you feel happy or proud to be a therapist, or even a funny story, whichever one?
We work with a lot of really cool different stories. And so the one thing, I have a few that I'm kind of like super proud of, but what I really love is working with a team. So it isn't just you who works to get somebody better. It's the strength and conditioning coaches and the chiros and the massage therapists, and we all kind of work together to get people to reach their goal or overcome injuries, which is super amazing. I think a lot of times people don't like to share, and you're not doing the best for that particular person and or athlete if you aren't willing to work with a greater population of people. And you learn so much more as a practitioner when you open yourself up to working with them. I think I've had, I had one a few years ago now, which is crazy, who got into a scenario where his health went downhill really, really quickly. We actually had to airlift him home, and his recovery was 6 weeks in hospital. And we weren't really positive if he was going to be able to continue on doing what it was he was doing beforehand. And so watching his progression and being a part of, coordinating his care from each stage, from working with the staff at the hospital, from the docs and the team there, and actually being able to be brought in and have a seat at that table when it came to recovery, because they were used to working with a certain population. And then we're looking at, like, he's not just that population, they're also an elite athlete. And so to be able to recover them was totally different. So working with the physios in the hospital was super cool. I was expecting a little bit more of pushback, but we were able to kind of communicate and work together to get them to a certain spot. And so now they're back, they're thriving. I think even the hospital administration that we were working with, like all the doctors and everything, were just blown away that we managed to get them back to this point. And so they've got a long career coming up for them, and his hopes of being a professional athlete are still there. And so that's going to be, it's amazing to watch that kind of progress and come through. But even working with athletes and getting them back from their ACL injuries that everybody kind of, has their issues with, it can be nerve-wracking, and taking somebody from that kind of state to getting them back into play is always a huge success, because you kind of walk in and I think the great thing about doing those rehabs and being a part of those rehabs is you see all the mental and physical roadblocks along the way. And so it's not just, and that's kind of the thing I love about Osteo that it brings in, it's not just working with that injury, you're working with that whole person. So to be able to help give them the confidence that they can go from being not able to walk because they're in their Zimmer splint to playing recreationally, professionally, whatever level it is that they're going to, and get back and be able to play that without having to worry about it, and getting that mental kind of side component in is always a lot of fun as well. It's the challenge. I love working with ACL injuries, and that's one of the reasons why, because there's such an up and down, but you really have to work with that kind of human component as well, and really kind of create that trust between the practitioner and the athlete or patient, and in order to get to those goals, or it's not going to happen. So those are the kind of things that you love watching when you're working together. And the other part of that is just, like I said, working with a team of people that blows my mind all the time, that I get to kind of communicate and work with them on a regular basis. And then you create those referrals as well. So when working with general pop type of people, you also have that referral base to kind of come back to and say, you know what, like, I think they need something more. And so you can kind of bounce ideas off each other. And I think that's pretty awesome too.
Yeah, I think that's the most, like, at the end of the day, that's the one thing that I think every profession should do, is really mold together and work with each other. And I couldn't agree more with you. I think there are definitely some circumstances that we've all experienced where we've also had to take the back seat because of our level of education compared to others, or just being able to have everyone's opinions versus just a few. I think that's crucial, because who knows, like you may have a couple years of experience in the field, but you also, could be very book smart or whatever it is. So being able to kind of put those all together is super important. And, that is a wicked story. That is incredible. Like, that's, to see that progression too is a dream, I bet. Like, wow.
Yeah. It definitely changed me as a practitioner, for sure, and the way that I approach things. 100%. I think you have those defining moments throughout your career that kind of help change and mold you. That was definitely one of mine. And I think the other part is you could be a really phenomenal manual practitioner of any kind, but it doesn't mean that you're the sole need for that particular person the entire way through. So have a team around you that can help you get to those goals or help that athlete get to those goals, and know what your role is in each stage. I think if you don't know who she is, Sue Felson, amazing woman.
Yeah.
She wrote a book called Bridging the Gap, which actually talks about how to incorporate a whole team approach into working with that athletic population and helping them get back from injury, and kind of the role each person plays along the way, which kind of explains that. Like, we should all innately know that, but we don't. And so I loved that. I dove into that book hard, and it was great. It's kind of the way that I have luckily come through my profession and the way that and the people that I get to work with. But it's out there to read, so it's a great one for people to kind of pick up and get into if they haven't already.
So definitely with that book that you're talking about, I agree. Like, bridging the gap is so important. And I think with every profession, there seems to be a gap, but hopefully one day we'll be able to kind of merge everything together and all be, educated in a great way on all, professions.
I think it comes down to like the connections you make and creating that team that you have around you ultimately as well, like finding those people who have those same core values, because not everybody's going to look at things the same way. And honestly, I think sometimes you don't want people on your team that look at stuff exactly the way that you do, or just working with the same person. So you want to have people who can kind of play off each other a bit. So I think it really comes down to just creating that core group of people that you get to work with. And I have because I work with Ken Basketball and I work with Matty at his gym, and being able to have those teams of people that are just, outstanding to work with, it makes your life and your job a lot easier.
Definitely, like, Matt Nickel is someone who is such an inspiration, and I couldn't agree more with you about, mentorships and all that kind of stuff, because his gym alone and all the people who are on his team, that is truly the definition of a team. Like, every single one of them brings something to the table every, summer when we had the privilege to work with everyone. And that is something that is truly important, because once you build that team, as well as, working on those connections and stuff like that, it will take you so much more in education as well as experience. So I completely agree with you. I think it is very key. And with that being said, with the amount of athletes that you've experienced working with and building that knowledge, with the ACL injuries and stuff like that, do you find that with the sports that you're working with, and applying some of those techniques that you've kind of gained with your professions, like with post-concussion or with concussion stuff, do you find that it has really skyrocketed with our education and knowledge in how to fix or maintain a concussion?
So my whole thesis for osteopathy, which is on concussion and the rehabilitation of it. So my thesis right now is looking at the effect of osteopathic treatment with a more focused on the thoracic region. I'm looking at to see what happens when you treat the viscera and the thorax, because we already look at the head and the neck, and we know we can make some pretty good changes, some pretty significant changes with people who have concussions. So I wanted to look at the thorax. I'm not saying don't look at all of that. I'm just saying right now I'm just really interested in what the effect would be if I do work on the thorax, and you can pull everything in later. But I would say it's tricky. I think people have a general understanding of concussion, and they know they're bad and don't put anybody back in while they've got one. But I think the lack right now, there's so much focus on trying to diagnose it, that there isn't a ton of information on how to recover somebody from a concussion. And so I get a variety of people now that and when we do have concussions, I get a lot of referrals for them. And I like working with them too. And they are a challenge, because it's such a crazy phenomenon of symptoms that occur, and trying to understand what happens is really the foundation and the basis of what I do as an osteopathic manual practitioner, which I'm not yet.
Soon to be.
From a recovery perspective, I think there's some gaps there that need to be filled, and there's not enough understanding around what's actually going on in order to do that. So the main areas right now that we're moving away from, rest is best. It's good for the first 2 days, like first 48 hours, and then you want to progressively start getting them to do more activity, are recovering better. So, and the longer that you put off getting them into that kind of scenario, the longer they have symptoms for. So we're looking at that. They're looking at the vestibular system and treating it. And then you're looking at the mechanics of what happened. And so I think really it all has, again, that comes down to playing with others and working with other teams of people and understanding when you need to refer somebody, but also knowing that maybe vestibular therapy and the ocular therapy you're giving them, if it's making your symptoms worse, it's not always better. And so you want to say, like, okay, for me, I'm gonna treat the cranium and get where the ocular nerve runs through. I'm going to look at any compactions in the cranial bones from maybe an impact you had, looking down through the thorax and the whiplash in your neck. We do a lot of strengthening there. And then looking at anything that could be kind of holding any kind of pattern, and freeing those restrictions, and then bringing the ocular therapy and the vestibular therapy back into it. And what I've found with some of the people that I've been working with is if the vestibular treatment is really setting them off, when we open up everything that I kind of just listed and then get them to do the ocular therapy, they're recovering better, and we're getting them back a lot faster. So we've had a few where they were out for months and weren't recovering in any kind of way, and we gave them 4 or 5 treatments to help open everything up, and then reintroduce some of the stuff that they were doing before. And there was a bigger jump and we got them back into play. So I think understanding those things is where there's a bit of a lack right now. And so everybody's pushing concussion and baseline testing. One thing we're moving away from right now is baseline testing, that it's not showing as much as it used to, because people and athletes have taken them so many times they know how to cheat on them. I just had a concussion, an athlete who admittedly lied on their baseline test so that it would be easier for them to get back into play later, and as a result suffered back-to-back concussions because they could pass their baseline. So essentially they were recovered according to who they were working with, and then missed 4 months of play and was an absolute mess by the time I got there. And so baseline testing is what they're really looking at, is saying, like, do that baseline scat test, but do it when they get their concussion instead of doing it before and then after and waiting to go back to your results from before. So we're moving away from that as well, and that's all up in the literature, and so yeah, it's an area I'm definitely thoroughly kind of immersed in right now. But I would say that those are the gaps that I'm seeing. Not a lot of doctors, like just GPs, really kind of understand outside of prescribing rest. That's still the number one thing they'll tell you to do. And then it's recovery. How do you do it? And how do you get them back safely? And I find a lot of people are afraid of concussions and working with them. And if they're not afraid, they're not directing people in the best way, because they haven't looked at everything that's out yet. So areas that really need some development is definitely rehab and appropriate rehabs. But again, I think just like with anything else, it's going to come down to making sure you have that team of people that can take you from point A to point B. So making sure you're getting looked at for your hands-on strengthening, neck strengthening, all of that, and then adding in that vestibular system stuff as well, and knowing when to back off and keep pushing as well.
Yeah. Yeah, absolutely. I think so many teams, unfortunately, are so dominant on using baseline testing as the only testing for pre and post season. And I think it's really tough sometimes because when you know how many tests should be done on certain people, or if if you start asking them, say these words back and they already know what those words are, I completely agree with what you're saying. It's tough because we're asking them to be honest, but in realistic terms, I mean, they already know everything what's coming for the testing. So yeah, I agree. It's a tough one, but definitely if you get the right team who really do have that experience in all those regions of concussion, pre, post, and inter, then you can go a long way with it. Absolutely.
It comes down to that trust in the therapist and the person that you're working with. If you know that they're going to help you, you're more likely to report it. I mean, that's even being shown in the research as well. Is just the underreporting because they don't want to miss anything, and so having that relationship with either the team you're working with, because I do that as well. I work with a lot of teams and a lot of athletes, and so you want them to be able to be comfortable coming to tell you that they have it,
Mm-hmm.
or they've sustained a concussion or any injury at all. But you don't want them to hide it because it'll make it worse. And if you have that relationship where they know that I'm going to come tell you I'm going to feel better, then I find underreporting is not as big of an issue. But you have to have that relationship with them for sure.
100%. And I think that's the tough thing sometimes when, like you and I have both done camps, and there's definitely times where athletes get really defensive and they say that they're fine on the bench or whichever because they don't want you to pull them from the game or whatever it is. And it's just like from a professional point of view, it's hard because you are truly really looking out for their greater good, but for them they just want to finish that game because it's the finals or whatever it is, and they're not thinking longevity wise of what their career is going to be, which is more frustrating.
I've had athletes that are, I mean, even just I got a concussion in training camp and that was it. It was over for them. And I had one in particular that had happened to every training camp for 3 years with this kid, but it didn't. So he never made the team, and he was fantastic. But he made all the subsequent teams, and is totally in our system. But every year he would do something and end up with a concussion or concussion-like symptoms, and it was enough that I was like, I can't guarantee that you'd be able to travel with us. So that means it's ending. And I do have a great relationship with that athlete. It's not somebody, he's not going to not call me and be like and tell me that there's something wrong. Because it is what it is, and he's still doing phenomenal. So I think it really, again, it's that trust in who you're working with that really helps that go.
Big time. Yeah, as long as they know that, you have the right intentions for them, and it's, you're not trying to purposely ruin their career or their soon to be career, or whichever it is. But so is there anything in just concluding this all, is there anything that you want the public or athletes to know about, the profession and anything at all that moving forward would benefit them to know about it?
Yeah. I'd say I work predominantly with a lot of athletes, but osteopathy is wonderful in that it looks at not just athletes. And in fact, a lot of people don't work with athletes. It's definitely for general population. I get a lot of people who come in because they just want to feel better. They want their health, or they're doing something preventative. I have people who have come to see me because, and I'm almost an osteopathic management practitioner, but I treat very craniosacrally. So you can have people who are coming in, I guess, from a student clinic perspective. We have people who come in with a range of medical conditions, which is sometimes super cool to be able to see the other side of it. So you work with an athletic population, you're seeing the same stuff over and over again. But we have people who have come into our student clinic to see us with asthma. Like, that's their main complaint. I have asthma, I have diabetes, I did chemo treatments, and I have breast cancer, or they've had some form of physical trauma, There's a lot of other reasons. I think we had one really cool one who came in with to see us for their main complaint was something to do with their kidneys. I can't remember. So the way that you look at things and the conditions that you can see, there's a wide variety of ways to look at it. And I'm always careful to say, like, we don't treat those conditions. We just treat the body that's in front of us and help it move as best as it can. So I really think that needs to be stressed too, is we're not treating those conditions. We're not diagnosing that condition. That's not in any way our job. Our job is just to help your body kind of function as optimally as it can, which is fairly similar to everybody else's profession. It just brings it into a deeper level and a deeper understanding through anatomy and ties it all in together. So it is by no means for athletes. I just tend to apply it to them because I work with them a lot. But there's such a broad range of things that you could work with and see.
Exactly. And thank you so much for coming on the show, Mary. It has truly been amazing and full of education. I hope everyone has taken a little tidbit from the show and is going to run with it and book appointments for osteo, because it is truly such an incredible therapy and it has so many benefits. Until next time, guys, cheers.